Kara Tomlinson, and I'm one of the nursing directors here at Nebraska Medicine. Our first and foremost priority is really to make sure that our patients feel safe and comfortable when they come back into our environments. And so we have to be able to manage our critical resources very well, and so that's one of our main priorities. And so whether that's staffing or personal protective equipment, which includes masks, gloves, gowns. If we think about a dimmer switch, if we have an abundance of those supplies and we feel comfortable that we can take safe care of patients, we're going to continue to gradually increase that dimmer switch and continue to increase the volume of patients that we see within our ambulatory environments, which includes our clinics, our laboratory areas, our radiology areas, our other ancillary areas. But if we start to see a decrease in those supplies or an impact to our supply chain, we have the ability and the flexibility to slowly decrease that dimmer switch again and lower our volume. So again, we can make sure that we are providing safe and efficient care for our patients. Things are going to look a little bit different for patients as they come into our environments. They'll first be met by some very pleasant people that are screening them as they come in. So some of the screening questions may include questions related to travel or history of being exposed or being positive for the COVID virus. They may also be asked questions about if they've been in contact with anybody that's had the COVID virus or if they're having symptoms, shortness of breath, fever, cough. They will also be asked to don or place a mask on their face that they'll wear through the duration of their visit. And that's just to protect themselves and the people that are around them if we're not able to maintain safe social distancing. And they will also be escorted to a hand wash station to make sure they thoroughly wash their hands before they come into our clinical environment. We do encourage and we welcome patients to bring their own masks from home. That not only protects them from the time they get out of their car, but to the time they get back to their car after their visit. And it helps us to maintain those precious resources for our healthcare colleagues here at Nebraska Medicine. There are so many uncertainties right now with the virus. And again, I'm going to go back to the main priority for us here at Nebraska Medicine is making sure that our patients feel safe and comfortable coming back into our clinical setting. And the only way that we can do that is making sure that our workstations are sanitized, our exam chairs and our waiting areas are safe, we're able to maintain that social distancing and provide adequate personal protective equipment for our patients. So I would anticipate for the foreseeable future this will be our new normal.